Hi, I'm Dr.Surindher. I'm the Principal Consultant and Chief Plastic Surgeon of Cosmesis India. We are Aesthetic Surgery Center in the heart of Bangalore on Brigade Road. Cellulite. Cellulite is again a common problem which women face, and it is not isolated to any age group. But yes, as you grow a little older, it's more apparent. And people often ask, if I do a liposuction or a thigh lift, does the cellulite go away? The basic understanding of what cellulite is what makes the difference in understanding whether it's going to go away or not. Some people come asking that whether we can do a lipo for a cellulite or do a thigh lift and the cellulite will go away. No. Cellulite typically, or actual cellulite which you see, is something called the skin having the orange peel appearance. If you look at the orange, you can see there are smile pits in the skin, and that is how the cellulite is. That is what is actually cellulite. If you look closely, even if you are wearing a bikini or a underwear, you can see that when the light shines, you will see that orange peel appearance, and that is what gives you that cellulite. Typically, cellulite is a problem which is within the skin. It is not a problem of underlying the skin. So what happens is liposuction, the bumps and lumps that you normally see, in which mistakenly people consider as cellulite, is not because of cellulite, it is actual fat. And that bumpy lumpiness, yes, if you do a lipo or a thigh lift, yes, that will improve. But cellulite typically doesn't improve either with a liposuction or a thigh lift, because it is within the skin part of it. So that will still stay. So we have to first differentiate whether it is a lipomatous or it is a lipomatous collection or a fatty collection which is causing the lumps and bumps, or whether it is actual cellulite. If it is lumps and bumps caused with the lipo because of fat, then yes, liposuction can eliminate a lot of that. And of course, if there is loose skin which is causing the folds, then of course a thigh lift will help it. But again, the misnomer or the misinterpretation of whether it is cellulite or what people normally call as a cellulite, when you look closely, is not. So depending, that is where your doctor or your plastic surgeon will come into your this thing, where he can actually differentiate and tell you whether it is cellulite or not. And that is when he will advise you, yes, whether a lipo is going to help it or not. But if you ask me as a blank statement whether cellulite is helped with liposuction or a thigh lift, then the answer is no. So differentiation is the key, finding out what the problem is the key, and then giving the appropriate solution is the key.